Senator Cassidy.
Dr. Shugat. Tell me, of those folks infected in the California epidemic, how many were native-born Americans and how many had immigrated here?
I don't have that information, but what I can say is that most of the importations that we have of measles each year are in Americans who are traveling abroad.
Now, when you say an American, though, an American who is a U.S.-born American.
Right. Mm-hmm.
Got you. So we've heard a lot about how the families from the wealthy communities of Santa Monica and the west side of Los Angeles are not vaccinating their children. But is that where we are seeing these cases? Do you follow what I'm saying? I did my residency in Los Angeles, and there are a lot of immigrants. And a lot of those immigrants may have fallen between the cracks. So, again, do we have any sense of who is contracting this?
Right. For the measles outbreak, we are seeing spread in some of the wealthier communities in California, for instance. Years ago, we had a lot of importations of measles from Latin America, which is where we have a lot of immigrants. But the Americas really took on the elimination of measles and did major campaigns around all of the countries and had great success.
When someone, can I ask then, I'm sorry, just because time's limited, when someone immigrates, what is their requirement in terms of immunization? If somebody's coming from the Philippines, what is the requirement now?
There's a requirement for documentation of vaccination against the vaccine-preventable diseases. And for children, the Vaccines for Children program actually makes sure that the refugees, for instance, would have access to vaccines.
Now, that would be for VFC. That's for children, by definition, less than 18. What if an adult immigrates from a country like the Philippines?
Right. That's not the case there, but most of the spread is coming from most of the risk is in children. If you survive to adulthood in most countries, you've actually already been exposed to measles.
So of those adults going to the Philippines and coming back, and they are the ones bringing the cases, is there any, I assume there's a travel advisor if you go to the Philippines, get immunized. Is there any effort in the Philippines? You've mentioned how the Americas have kind of bucked up their immunization efforts. What about the Philippines?
Yes, there are efforts there. Unfortunately, the Philippines suffered that horrible hurricane, and after the weather problem, much of their immunization infrastructure was destroyed. And so they have had a really bad measles outbreak in response, and are really, actually CDC and others have helped respond to help them work on their immunization campaigns. You know, the biggest outbreak we had last year from of measles was in travelers, a couple Amish adults who traveled to the Philippines who'd never been vaccinated and brought the virus back to Ohio. It turned out the Amish community really stepped up to be vaccinated, but that was a large community where very few people had been immunized. Fortunately, in the U.S., most communities have high immunization rates, and it's just these newer communities where parents are opting out that we're quite worried about.
When we travel overseas, oftentimes we need an immunization record. And so when the fellow from my church just went to a mission conference in the Philippines, I should ask him, but was he required to show his vaccination record, et cetera, to go, and is it required MMR?
He wasn't, but we hope that we're reaching him through our outreach efforts. We were concerned that with the Ohio outbreak, we hadn't reached those travelers. They hadn't realized they should have been immunized, and in fact, they were misdiagnosed.
Now, that seems like an easy thing to do if you apply for a visa, to put in a note saying, listen, you're traveling to a place with endemic measles, huh?
Yeah, there are a lot of electronic prompts and so forth now that do alert you, but you know, not with our alerts, they're not 100% in terms of people following them.
But is that something that we, when we approve a visa, or somehow it seems like there should be some process by which somebody is traveling to an endemic country that we would remind them of their risk?
Yeah, definitely we could look into that.
What about immunization rates since 2009? Have they risen or stayed the same?
They've risen for some of the newer vaccines, and they're stable for the others. And as I mentioned, we track very closely the % of children who received no vaccines at all by age 2.
So somewhat stable. I just am wondering about Senator Murray's statement. You seem to concur that the Affordable Care Act may have improved immunization rates, but I think we know with the CHIP program and the Vaccines for Children's program, I've done a lot of immunization work among children, that really cost has not been a barrier for immunization for children for some time, again, because of VFC as well as for public health units. Would you accept that?
That's right. It's adults where the vaccination record rates are very low, and then we have some lagging coverage in teenagers, particularly with the HPV.
But VFC would not, for example, require hepatitis B coverage in an adult, I presume.
No, the VFC just covers
And nor does
people
the
through
ACA?
age 18.
And the ACA would not either.
No, the ACA would cover vaccination of an adult with hepatitis B if they were in a recommended.
If they're at risk, if they're
Right.
at risk, a gay man or something like that.
Well,
But I do think it's important for the record that for childhood immunization, the Affordable Care Act is really, not hurt, but it's certainly not augmented that which was previously there.
The Vaccines for Children program has had huge impact, and it's really
Yeah.
been a
The
wonderful.
VFC, but not the ACA.
We need to keep moving.
I yield back, I'm sorry.